My name's Janet King. I'm the Deputy Chief Executive at Frimley Health NHS Foundation Trust.
My name is Phil Brady. I'm an Equity Director at Peterborough Associates.
I'm Dan Townsend. I'm an Associate at Peterborough Associates.
Hello, I'm Jago Keane. I'm Tree Consultant at Keane Consultants.
Okay, so how long have I been working with Val Williams? I think it's actually about 15 years and actually quite continuous throughout that 15 years. You know, we've always had so much work going on, but there's always been a need for the help and support of Val Williams. I haven't used a lot of other companies. I've used one or two, but I would always revert back to Val Williams. I think we have a different relationship. I think that, you know, they really work alongside us, are fully integrated to our team, and I can honestly say that at some meetings and some big projects you couldn't tell the difference between a Frimley Health employee and a Val Williams employee, which is exactly how it should be.
One of the key differences with Vail Williams is they make you, me as an individual, as a tree consultant, part of their team. That's really good because I can then talk with them, we can work things out together, and actually by being a player on their team we get better results for the client.
Working with Vail Williams is slightly different than working with others in that we have a personal relationship with a lot of the staff there. We've worked on multiple projects around the country and there is a trust there in terms of us taking the project forward with them.
I think that in terms of particular areas of expertise, which we really could not have done without their support, planning really is the big one. And this is not just little ordinary everyday planning applications, but this is major multi-million pound projects where actually you're looking at developments on greenbelt, things that are much more technically difficult with a lot of politics involved, and without the kind of guiding hand, advice and support from Val Williams, we probably would have taken a lot more time to get the good, well, excellent results actually that we've had in the end. So what do we use Val Williams for, apart from planning, where we have, I've worked with James Lacey for years on planning issues, but I've also worked with other senior people at Val Williams. So for example, Chris Cave and Andrew Osborne, so they did a lot of work for us on viability, and as a result of that work actually we saved millions of pounds on some of our projects. So their expertise, we couldn't have done that in-house ourselves. That's why I always think we should use external advice, is where you just cannot do it yourself. The quality of work that they produce was superb.
One thing I find with James particularly is he's constantly online. If I need to talk to him, if I need to sound something out with him, I can get hold of him more or less whenever I want. I try not to abuse that, but I can get hold of him. He'll happily give me the time to talk through an issue, and so then what we can do is quickly find a resolution and get that service delivery for our client.
And I think other people that I would also, you know, want to flag up are people in the back office really, or supporting people. So people like Sam Osborne, you know, she really is the glue in that team, and you know, make sure we got all our agendas and paperwork is immaculate, and she progresses all our programs, you know, quietly and very efficiently behind the scenes. So she's very impressive. And in fact, I know that on one particular occasion, she was working all weekend to help the Trust with an application that we were making. We had to get some extra information in, and she just didn't stop. You know, it was really brilliant.
I think with Heatherwood as well, it's one of those projects that, in a recession where where people are closing hospitals, to actually work on a hospital to build a new one is actually inspiring. And that, I think as a project team and through Vail Williams, you got that sense of inspiration to move the project forward, as much as it had challenges.
In terms of the Heatherwood project, it is obviously a landmark project. It is relating to Greenbelt. It's been called in by the Secretary of State. It initially had an officer refusal going forward All of those things have been unlocked by the project team, and a key element of that is the fact that Vail Williams were involved, and that at the beginning of the project they clearly understood that consultation was one of the key issues. And in doing the consultation early, in doing it widespread, we brought on board the groups, we brought on board the public, and those people were the people that actually supported the scheme going forward, and inevitably it leading to its success at the committee. And obviously the Secretary of State also then looking forward and saying that they could agree with it coming forward as a development.
How important is Heatherwood Hospital to Frimley Health? Well, it is major importance to the hospital. It's our biggest capital building that we've ever had, the biggest investment that we'll ever make. It's going to be a fantastic hospital for the local residents of Ascot and the surrounds. A state-of-the-art elective centre, doing a lot of orthopaedic work there, but same-day surgery. We've got the latest thinking in NHS building design. We've put it in the woodland because we felt that that was in the best interests of our patients. They have a wonderful environment to recover in, and Vail Williams helped us with that. It could have been very easy for them to say we could get this planning application for you far quicker if you build it on a lump of concrete, but actually they accepted and supported the trust in what we were trying to achieve. So it is going to be the most fantastic building and provide a really great service for the local population.
Heatherwood Hospital, that is a classic Vail Williams success. It was with Vail Williams that, talking about unity, they brought us together, they held us together, and they drove us forward so that we could deliver that project. It was a really difficult project to bring to fruition. New hospital in a woodland. From my point of view, that's a tricky challenge, but here was an example. You deliver a hospital for community benefit, but rightly the council challenged it all the way through because that's part of their role in the planning process. But because Vail Williams were with us, leading that charge, using their energies to get this project to success, and that's what's got us there. That's why we ended up with planning permission for a new hospital for the community at Ascot.
Why do we use Vail Williams? Why do we want to continue to use Vail Williams? Well, I would say that we really have got a good partnership going, and it's been a long relationship. There's a lot of trust between the parties. They're very supportive. I think that they get a lot from working with the trust as well, give us a lot of added value. And although we do test the market, that's what we are required to do, I know of no reason why we would want to go somewhere else, and we are really, really happy with the service that Vail Williams provides us.